What types of lipid-lowering drugs are available today? If you are curious about the different types of lipid-lowering drugs available today, you are in the right place. Let's break it down in a simple way. Lipid-lowering drugs are essential for managing hyperlipidemia, which is when there are high levels of lipids, mainly cholesterol and triglycerides, in the blood. These medications help reduce the risk of heart disease and other cardiovascular issues. First up, we have statins. Statins are the most commonly prescribed medications for lowering low-density lipoprotein cholesterol, often referred to as LDL cholesterol. They work by blocking an enzyme in the liver that is responsible for cholesterol production. Some popular statins include atorvastatin, simvastatin, and lovastatin. Next, let's talk about Ezetimibe. This medication reduces the absorption of cholesterol in the small intestine, which helps lower LDL cholesterol levels. It can be used alone or together with statins for better results. Now, we have a newer class of medications called PCSK9 inhibitors. These are injectable drugs that block a protein that limits the liver's ability to remove LDL cholesterol from the blood. By doing this, they help lower LDL cholesterol levels significantly. Examples include alirocumab and evolocumab. These are often prescribed for patients who do not reach their cholesterol goals with statins alone. Another option is bempedoic acid. This medication works differently from statins by inhibiting cholesterol synthesis in the liver. It is particularly useful for patients who cannot tolerate statins. Fibrates are another type of lipid-lowering drug, mainly used to lower triglyceride levels. They can also help increase high-density lipoprotein cholesterol, known as HDL cholesterol. Common fibrates include gemfibrozil and fenofibrate. Niacin, also known as nicotinic acid, is another option. It lowers LDL cholesterol and triglycerides while raising HDL cholesterol. However, its use has decreased due to side effects and limited benefits when combined with statins. Prescription omega-3 fatty acids, such as icosapent ethyl and lavazza, are effective in reducing very high triglyceride levels. They can be used alongside statins to further lower cardiovascular risk. Lastly, there are emerging therapies like monoclonal antibodies and antisense oligonucleotides that target different pathways in lipid metabolism. These new medications are still being studied but show promise in treating lipid disorders. In practice, treatment usually starts with lifestyle changes and statins. If cholesterol goals are not met, doctors may add Ezetimibe or PCSK9 inhibitors. The choice of medication depends on individual lipid levels, cardiovascular risk, and how well a patient tolerates the drugs. With this variety of lipid-lowering drugs available, healthcare providers can tailor treatments to effectively manage hyperlipidemia and help reduce the risk of heart disease.